Check the baby's wristband. Let's see, I had a baby boy, date of birth, 8/20/2020. All right, so I had a baby boy. So whenever I started, I'm gonna start with my head circumference. My head circumference was 37 centimeters. His head was round, no abnormal shapes. Thin black hair was present on the top of the head both days, and that's within normal limits of 32 to 37, which is old 764. His anterior fontanelle was diamond shaped and soft and level with his top of his head, and I measured it. So length, it was 3 centimeters long, 2 centimeters wide. And then his posterior fontanelle, found it, and it was 1 centimeter long by 0.5 centimeters wide. Okay, so his blink reflex, shine my light in his eyes. His pupils were white, his sclera was white. I could see the red of his retina. His pupils were reactive and parallel to my light. There was no discharge coming from the eyes. His blink reflex was present because whenever I shine my light, he would kind of blink his eyes, and that's on old 689. His nose was symmetric and midline to his ears. There's no discharge or drainage coming from the nostrils. His nose was like the classic button shape for a newborn. His mouth and lips and oral cavity, they were pink, moist, and there was no bleeding or abnormal drainage. His sucking reflex was strong because I put my finger in his mouth and he sucked on a little bit. His rooting reflex was also there and present because when I would like kind of scratch his face, he would just kind of like start licking his lips and stuff. And those were both on old 667. His face overall was round and symmetric. There was no abnormal lumps or abnormalities. His eyes were the classic almond shaped, symmetric to his face and also midline and even with his ears. His ears, they also were symmetric. The cartilage on his ears was kind of flimsy, but also like enough cartilage to kind of like go back to his form whenever I pulled it up. My newborn did pass his hearing test in both ears, which is good. That means he has no difficulty hearing, and that's on Wong 119. His neck was short with skin wrinkles in it. He didn't have much control over his neck movements other than just kind of turn it left and right, but he could not like nod up and down. His NIPS pain scale was a 0, as evidenced by there was like no crying or facial grimacing or increased respirations. His palmar grasp reflex was present both days, as evidenced by I would grab his hand, I would let him grab my fingers, and he would wrap his fingers around my finger. His molar reflex was present because I would pick him up out of his crib and hold him up a little bit and then just kind of let him down, and he would just kind of like flay his arms out and curl his hands. And that's all on page 667. And 1 second, someone's knocking on the door. It was Miss Sunshine. Anyways, chest circumference. Chest circumference was 32 centimeters, and that was both days, and that's within normal limits of the 30 to 35, and that's in an old 688. His abdomen was soft, a little bit convex. It did move with respirations, but there weren't like strong, like any retractions. There was no abnormal color. His skin was warm. There was no presence of acrocyanosis or jaundice present. No chest retractions, breathing. The umbilical cord, it was clamped. It was like a blackish color both days. There was no drainage or bleeding present around it, and I did perform skincare both days. His posture, whenever he was in his crib, he laid supine. Usually he had his arms flexed up while he was swaddled. His legs were flexed at the knees, and he did lay supine. His skin, like I said, was warm. It was like a dark tannish color and appropriate for a Hispanic male ethnicity. There was no vernix caseosa present anymore, but he did have scant amount of lingua present on his back. On his palms of his hands, he did have these creases. It shows appropriate gestational development. And on the palms of his feet, he also had the creases. His height, was 49.53 centimeters both days, and his weight was 3.1 kilograms on day 1 and 2.8 on day 2. And that is within the normal limits of a 10% weight loss. However, it is right at the 10% weight loss, so we would need to watch his nutritional status very closely. His range of motion in all his extremities, especially his arms and legs, he had good range of motion in his shoulders and his elbows and his wrists and his fingers. He didn't have any restrictions on both arms. And also the legs, he had a good rotation in his hips, his knees, his ankles, and his toes. Capillary refill I took in both hands, and it was spontaneous return in both hands. There it is by his palms, and also on his feet, just on top of his feet and the bottom of his feet. They were both spontaneous as well. His plantar reflex was present, as evidenced by I would kind of just hold his bottom of his foot, and he would just kind of wrap his toes around my finger. His Babinski, and that's on old 667. His Babinski reflex was present as I would stroke his bottom of his foot down, and he would just kind of flare out his toes like that, and that was present both days. His femoral pulse I took both days, and it was equal bilateral both days present. I had a baby male, so I assessed his penis. It was a light tan color. He was uncircumcised, and I was able to retract the foreskin back and look at his actual head of his penis. And there was no discoloration or bleeding or drainage present. His testicles were also, they had rugae on them. They were kind of firm but soft, really more soft, but they weren't just squishy. His anus, I checked, and he didn't have any hemorrhoids or fissures. He was clean and dry. Put his diaper back. Okay, so I took his axillary temperature both days. On day 1, it was 98.2, and on day 2, it was 98.4, which is within the normal limits of 97.5 to 99, and that's old 686. Next, I listened to his heart rate, his apical heart rate, and I listened for a whole minute between his 4th and 5th intercostal space. I listened for a whole minute, and on day 1, his heart rate was 152 beats per minute, but it was regular and bounding and easily auscultated. And on day 2, it was 124, and that's still within the normal limits of 110 to 160, and that's old 685. The blood pressure was only taken one time in the chart, and that was at the day, right after the delivery, and it was 90/39, and that's actually above the systolic range, because the systolic range is 50 to 70 over 30 to 45, so it's actually above normal limits. His respirations, I counted those for a full minute. I just watched his chest retractions up and down, not retractions, but like his rise and fall of his abdomen. And on day one, it was 54 breaths per minute, and they were at a regular, like just normal pace. And on day two, they were 52 breaths per minute, and again with a regular rhythm. That's within normal limits of 30 to 60 on page Olds 686. He had no signs of cyanosis or respiratory distress. He had no nasal flaring, no abnormal chest retractions. No, he wasn't cyanotic. He wasn't crying in a high-pitched, shrill way, and he wasn't grunting his inspiration or when he was breathing in. So I listened to his anterior lung sounds. And now I listen to his posterior. So all of his lung sounds were clear both days. There was no abnormal like sounds of crackles or wheezing present. I also listened to his bowel sounds both days. In all four quadrants, I would listen until I heard bowel sounds. And in all four quadrants, both days, that bowel sounds were present. His O2 saturation was actually not charted in his chart. I looked all the way back since the time of delivery, and they were not charted, and I even looked in the physician's notes and couldn't find them, but I told Miss Bradley. The feedings on day one, the patient, he breastfed with his mother on day one, it was her right breast for around 10 minutes, but then the mother was having some difficulties and switched to a bottle, and he ate 11 milliliters of Similac Advance on day one. On day two, he breastfed for a little bit longer for 15 minutes on the left breast, but then the mother again just thought it was easier to bottle feed, and she bottle fed him after the breastfeeding, and he ate 10 milliliters of Similac Advance. His stools, on day one, he had one passing of meconium, and it was black and tarry. Wasn't necessarily just stinky, but he did pass that. On day two, he had another bowel movement, and it was more greenish color, but still that greenish black meconium. On his voids, on day one, he had one wet diaper. It was just kind of like a yellowish amber in color. It wasn't necessarily just strong in odor, and he just had a wet diaper. I changed it, and I performed like perinatal care and skin care. And on day two, he had another wet diaper while I was there, and I did the same thing. It was just like a yellowish amber color, no foul odor. I changed his diaper, and I performed skin care again. His growth and development, as I said earlier, he did have the creases on the palms of his hands, the lanugo on his back. His reflexes were all present. The creases on the bottom of his feet were present. He had no birthmarks or anything like that. Periods of reactivity, I wasn't actually there during the periods of activity that were occurring, but the first one he would be active and awake. The second one he would go to sleep, and it lasts for around 2 or 3 hours. And the third one, the second period of reactivity, he was awake again and stuff. Behavioral state, for most part, he was in like a drowsy or semi-dozing state. He slept a lot if he wasn't eating. The only time he was awake is if he was eating. And the patient-parent, the newborn parent interaction was actually very good. The father helped take care of the baby and held him. The mother would hold him and take care of him, and they would always look at him and smile, so it was very good. And that was on both days. So swallowing back up.